Hello, my name is Tom Hunt. I'm a physician assistant at the Orthopedic Foot and Ankle Center. Today I will be demonstrating the proper placement of a surgical dressing with a cold therapy pack built in. We have a sample patient here that I will use to demonstrate to all those that need education regarding the proper splint placement with the cold therapy pack being built in. What you will need as far as your supplies is you will need some form of splinting material, whether that be a plaster or a fiberglass material. You will need 2 sterile rolls of web roll, 4-inch, and 2 non-sterile rolls of web roll will also be needed. You will need a 6-inch ACE wrap to finish your product of your splint, and you will need your ice therapy cold pack to be able to put in. Before putting this in, always make sure to inspect it to make sure that it does not have any holes. This will help you in the future for the patients who may have to call with problems and troubleshooting for leaking. So with this particular patient, we will start with the web roll. We want to make sure that the patient is securely on the chest or that somebody and an assistant is holding them at 90 degrees and maintaining that position. We will start wrapping our web roll, which is a sterile fashion. The patient will have a surgical dressing already in place covering the wounds, but this individual has not had a surgical dressing. We will wrap around the foot, covering over the toes by about 1 inch and wrapping back down. Again, at this stage, always making sure that the patient is maintaining the 90-degree dorsiflexion position. We are wrapping approximately half of the web roll over top of itself, and we were ending approximately 2 centimeters below the tibial tubercle. Once we get to the tibial tubercle, we will then start wrapping back down the leg, again maintaining our 90-degree position of the ankle and dorsiflexion. We are making sure to carefully protect all the bony prominences, making sure to carefully support the heel, as these are the places where we may develop pressure ulceration, and we want to certainly try to avoid that, and making sure that we're covering those prominences is absolutely imperative with proper posterior splint management. Once we have our 2 first layers of web roll, we are now protected. The patient is maintaining the 90-degree position. We then, depending on our splinting material, whether it's fiberglass or plaster, you will have to wet this to start that exothermic reaction. We will then locate our location just at the web roll and below. This will assure, if we are at the tibial tubercle level, that we're not going to get this patient splint into the back of their leg when they bend their knee. We then bring this up to the level of the toes, just beyond the level of the great toe, and place that position back. What I'm building is a foot plate. A lot of our surgeries are 4-foot driven, and we want to make sure their toes are safely secured so they don't hit their toe in the splint. Once we have this in place, I then will use the web roll starting at the tibial tubercle to cover my splinting material. This last layer of web roll is important, particularly with the plaster, because the plaster can stick to the ACE wrap. When we take that off at the first postoperative visit, that ends up creating a sticking sensation to the ACE wrap, which then pulls on the splint and their surgical dressing. So this just allows this to adhere more comfortably to the plaster or fiberglass material. Once I have that in place, I then will cut a small slit on the medial side and again on the lateral side. And this allows me to then build that footprint to where I can still visualize the toes to look for any type of vascular compromise, or if there's pins in place, we can make sure that we're safely able to visualize that with the patient. Now the time is to be able to put the cold therapy unit on. Depending on the type of bladder you have, you may see the bladder centrally located with the stem, or you may see the stem off to one of the sides. If it's centrally located, it's important that we shift this over either medial or lateral. Medial tends to fit a bit better because a lot of the patients are on a leg caddy, and we don't want that to be centrally located to where they cannot be on their leg caddy. We start with the ACE wrap just proximal to the ankle joint, and we secure the first layer of the bladder. Making sure to keep this flush with the patients. We then come up over the foot plate and we tuck this underneath the toes, building again that foot plate that we can see the toes but secure the splint. We then have to finally wrap the rest of our web roll, securing the rest of the ACE wrap. At this point, we then come up and include the web roll and then finish ultimately locking in the bladder stem so they can easily have access to this in their post-operative course and can easily plug it in to their cooler apparatus. This completes the proper posterior splint placement with built-in cold therapy.